This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit AmericanMobile.com to get started.
Honestly, though, I will tell you, being a med surg nurse, like managing behavioral problems and issues and being able to like recognize behavioral escalation has been like just, I have just become so much better at that. Because,
Yeah.
just being at like risk assessment and stuff like that. And I feel like since we
Mm-hmm.
see a lot of those different diagnoses, like any sort of infection, like you're just a urinary tract infection with a history of a psychiatric illness, it can just get exacerbated with this illness, even if like if someone has an increasing age,
Yeah.
um, or things like that, or if someone's medicines are for some reason messed up because like their kidneys aren't doing very well, so
Mm-hmm.
their levels have built up and there's problems there.
Yeah.
um, so it's just hard. It's hard, really. There's a lot of very kind people in med surg, like patients, everybody. Some people are so awesome, and everywhere, and there are some people who are more challenging.
Yeah.
But I don't know if that's necessarily 100% specific to med surg, but I do know we've
You
seen
can, I
some
mean,
interesting people.
I would argue that it is, in a sense where a lot of people come in for altered mental status because of an infection. I mean, like, we can go into like actually different reasons why people are, categorized into med surge, but like, a lot of it is sepsis,
Hmm.
and elderly patients don't do well with sepsis as far as,
Hmm.
mental status. Like you said, UTIs. It's like one of the main reasons. As soon as like a elderly patient is confused, it's
You're
like
like,
the
oh,
main, yeah, like, maybe we should get a urine,
right.
that,
A lot of
yeah, I could
pneumonia.
totally see, it's interesting because like I've, I think acute care nurses probably are some of the best people that are able to navigate those situations, behavioral de-escalations, just because a lot of times in, procedural areas, they don't have to deal with that very often. ICUs, a lot of times, people are intubated, sedated, you don't have, most people aren't, oh, well, a lot less people are awake in those situations. So like as an acute care nurse, see everyone and, in every point and stage in their life, whether they're, acutely ill and confused, or they might be like ornery because they're waiting on, dispo going and rehab, or we just don't have a plan for them. And
That's always the
that's
best.
super frustrating in itself. What do you feel like do you have any, it's a really hard thing to navigate, especially as a new nurse too. Do you
Oh
feel
yeah.
like you gravitate towards, acting in a certain way for those patients, or how do you feel like what works for
You
those like
know,
behavioral de-escalating?
it's so dependent. Like you really have to feel it out, and honestly, a lot of it's trial and error, which is unfortunate.
Mm-hmm.
But that kind of is one of those things that I pass on and report. Like, let's say I was a patient was admitted to me, and I've noticed certain things escalate them. I'll pass it
Mm-hmm.
on and report like, hey, just so you know, like if I ask these like a lot at my past assignment, there was a patient who, when you'd ask a lot of questions, he would start to escalate his behavior and start
Mm-hmm.
yelling. So, if you needed to go in and ask a question, you make sure to prioritize your questions that you really need answered at the beginning. And then when he
Mm-hmm.
starts, well, you could tell because would start like becoming louder, kind of look like staring at you. And you're like, okay, I think now is a time to pause and I will leave and I will be
Yeah.
back. Or certain patients like to have like that comforting voice, the calm, okay,
Yeah.
tell me what's going on. Like, let's sit down. Some patients need a little firmer of a hand.
Mm-hmm.
Sometimes, it's an unfortunate situation, if you're dealing with, because I know you've had a lot of patients who've had TBIs, and like it's a similar kind of
Mm-hmm.
situation. You have to
Yeah.
feel out kind of what's working in this moment, what has worked in the past, kind of like navigating that.
Yeah.
So it's really so dependent. Like I had a patient one time who he was like doing final days, started kind of getting a little more confused and agitated. And had a really good relationship for most of the day, but he was not listening to me. And I was like, oh, you need to get it back in bed. Elderly gentleman came in with a fall, and he had a urinary tract infection. And so, I come in there, and the charge nurse had been helping me because he had behavioral issues in the past, and the charge nurse was male. And he came in, was trying to help me, and the patient's sitting on the side, get him out of the room. Do not talk to him, and he's been helping me all day. And I turned to him, I was like, sir, to the charge nurse, I'm like, sir, you need to get out of this room immediately. and he looked at me so confused. He was like, what? Like, I'm here to help you.
Are you sure?
Yeah, like, oh, okay, because he's like yelling at you right now. And the second I did that, the patient like listened to me, like got back in bed. It's just like, that's what he wanted. Like, he wanted to, like, I don't know, control something, or didn't want him in there. And so that de-escalated him, which is, it's so funny. Like, and just the look on the charge nurse's face was like, what?
Like what tactic are we using right now? You want to be alone with this guy? Okay.
Sir, please remove yourself from the situation.
That's so funny. Oh my gosh. That reminded me of something I saw the other day when it's like fighting my dementia, like my dementia patient was afraid like somebody was in her room, and like you see this guy like air punching the, like beating up this like whoever was in the room, and the patient's like, oh, like they're getting him.
I think I saw something similar where it was like that kind of situation, and it was this nurse who's like, okay, sir, let me put this oxygen back in your nose.
I think it's
straight
that
up punching her.
I don't know. Oh my gosh.